February 28th is Rare Disease Day, and today we are talking about A1A. This is something really personal to me. My dad was diagnosed with it, and so today I'm going to go get tested here at St. Mary's. I'm joined by Rhonda Sheridan, and a lot of times this is something that actually gets misdiagnosed.
Alpha-1 antitrypsin is a protein that your liver produces, and it goes to the lungs to fight off infection. 4% of COPD patients, it's due to that alpha-1. They're not producing enough of the protein. So what happens is if they're not producing it, acts like COPD. So a lot of times it's misdiagnosed.
Okay, so what are the symptoms or like the red flags you should look for?
If you're experiencing any of the normal symptoms for COPD, if there's coughing, shortness of breath, those are things that you want to look for. If you're having shortness of breath doing daily activities. The difference, some of the red flags that might pop up is you might hear someone in their family that has COPD and they've never smoked. Generally, cigarette smoking is the #1 cause for COPD. So if you have someone that has COPD that's never smoked, that's definitely a big red flag.
Now, besides COPD, is there anything else symptom-wise people should keep an eye on, basically?
There are common medications and treatments for COPD. And if they have alpha-1, sometimes those patients don't respond the same to those treatments and medications as other COPD patients would. So that could be a red flag as well.
All right, well, let's get to it. So what does the test entail?
It's a simple finger stick. Do you care which finger I stick? Do you care?
Middle. Okay.
All we'll do is we'll clean the side, and it's just, if you know anyone that's a diabetic that sticks their finger for the glucose, it's just like that. 1, 2, 3, that's over. Okay. And then all we do is we'll take the blood and we'll fill in the little circles here, and that's it.
It's that simple.
It is that simple, yes. And then once it dries, we put it in an envelope, ship it out to a lab.
And it'll be back in about 2 weeks.
Usually it takes about 2 weeks to come back, and what the results are going to tell you, it'll tell you the amount of the alpha-1 concentration, the protein concentration that your body's producing, but it will also tell you the genes that your parents have passed down to you.
Okay, so we know it's hereditary, but is anyone, say, more prone to getting this?
Anybody can have it. That's the purpose for testing, because you just don't know. But we do know that it is hereditary, so it's important to look for some red flags. But generally, it's not until they think that they have the COPD or the emphysema that it kind of comes to light that it could be due to the alpha-1 protein. So anyone that comes into our program that has lung problems, then we do go ahead and test them for the alpha-1.
All right, so we have to wait for the results, but when they come back, what are we looking for?
There's really 3 things that could go on. You could either be totally deficient in it, which means you're definitely not producing enough of the protein. And if that's the case, that's when you would want to be on the replacement therapy. Then you also have a carrier, and that's generally what most people are. And what the difference would be is you're producing enough of the protein to where you're able to fight off infections and you're doing fine, but your parents have passed down a gene, so you have one normal, one abnormal gene. That would make you a carrier. So the treatment for that would be to live a healthy lifestyle. You don't want to smoke, because what happens is if you have a normal and an abnormal, that would put you at higher risk for lung problems than someone that's got the normal genes.
Again, that testing is completely free. All you have to do is call the number on your screen. We'll also post that for you on our Facebook page, First Look at 4. Rhonda, thank you so much for your time.
Thank you for having me.